Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Nwaka. First, the highlights. As the highly transmissible Delta variant is found in over 104 countries worldwide, states in Nigeria insist on safety measures. African Development Bank provides over $288 million to support federal government in fighting the coronavirus. And Prime Minister Boris Johnson to confirm the plan to lift almost all legal restrictions on social contact in England on the 19th of July. Last week marked the fourth consecutive week of increase in cases after 10 weeks of decline. There are reports of hospitals reaching full capacity, with the Delta variant driving a new spike in cases and putting pressure on health systems and health workers. According to Dr. Tedros Ghebreyesus, WHO DG, as countries lift public health and social measures, they have to consider the public health workers. He says these situations are particularly bad in countries with low vaccination rates, particularly in low-income countries where oxygen, personal protective equipment and treatments are hard to come by. Meanwhile, Nigeria recorded 2 deaths last night from the coronavirus, raising the country's total fatality figure to 2,124. Also, new cases, according to the Nigeria Center for Disease Control, were recorded in 3 states, Akwa Ibom, Ogun and Rivers, reporting 6, 4 and 2 cases respectively.
After a record of more than 100 daily COVID-19 figures in the last 72 hours, Nigeria witnessed a decline in the number of infections in the last 24 hours, as the Nigeria Center for Disease Control announced 12 new infections reported from 3 states. The breakdown includes 6 cases from Akwa Ibom, 4 cases from Ogun, while Rivers State reported 2 infections. Lagos State, the epicenter of the disease in Nigeria, which accounted for the highest number of cases in the previous 24-hour cycle, did not report any infections in the last 24 hours. The latest update also includes 0 cases from Ekiti, FCT, Imo, Kaduna, Kano, Nasarawa, Oyo, Plateau, and Sokoto states. Nigeria now has a total of 168,552 confirmed cases. 8 people have been discharged in the last 24 hours, raising the total number of recoveries to 164,439. 2 people were confirmed to have died from COVID-19 complications, increasing the fatality toll to 2,124. Presently, there are 1,989 active cases in the country, while over 2.3 million samples have been tested so far. The latest update by the National Primary Healthcare Development Agency shows that more than 2.5 million eligible Nigerians have received the first dose of a COVID-19 vaccine, while over 1.4 million persons have been fully vaccinated. Lagos State has taken the lead as it now has vaccinated more than half of its eligible population, followed by the FCT, Kano, Kaduna and Oyo states. More than 75% of vaccines supplied have now been administered across countries in Africa, while there are over 5.9 million confirmed cases and more than 151,000 deaths on the continent. Globally, there are more than 186 million confirmed COVID-19 cases, while deaths have surpassed 4 million.
This is Channels Television's breaking news.
And we're cutting to news just in that the Emir of Kano, Al-Hassan Adamu, has been freed after spending a night in bandits' captivity in Kaduna State. The other 13 members of his family are still with the kidnappers, who earlier demanded 200 million naira as ransom. It is not yet confirmed if any ransom was paid before the release of the 85-year-old traditional ruler. And that news just in, the Emir of Kano, Al-Hassan Adamu, has been freed after spending a night in bandits' captivity in Kaduna State. We understand that other 13 members of his family are still with the kidnappers. We bring you more developments as we get them. And now the Ebonyi state government says it has perfected plans to stop the entry of the Delta variant of COVID-19 into the state. The acting commissioner for health, Dr. Richard Nabu, disclosed this while giving an update on the efforts made by the government. According to him, the experience of the first and second wave have made them better prepared.
The discovery of the Delta variant of COVID-19 is raising concerns across states, with health authorities now monitoring the situation closely and trying to understand its attendant peculiarities ahead of a possible third wave. With lessons learned from the first wave of the pandemic, the Ebonyi state government believes that the ongoing vaccination drive and enlightenment campaign in the state are a proof that the state is fully prepared for eventualities.
When the virus got into Nigeria and eventually got into, even before it got into the States, we had a committee, we had the Emergency Operations Center, we had structures on ground, and that structure has not been collapsed. We're actually working very tirelessly. And since then till now, we've been screening people, we've been, taking, even doing the vaccination, it's been ongoing in the States.
Health officials in the state also give an assurance they will not let down their guard.
With even all the fake news, magnetic and whatever, some of the places we vaccinated. In fact, we went to a place at the precisely civil defense. They brought their key. So after vaccinating somebody, they placed it and the key fell off. They say, oh, that means that thing is fake. So those things, they are fake. So we are just, all our effort is geared towards mobilizing the people to be ready, to be receptive of the vaccine, because it is safe, it is the surest way to protect against COVID vaccination, against COVID disease, and we are on it.
For now, we cannot tell whether we have it or not, but hopefully, when we have it, we feel that we'll still be able to, handle it. We do the best we can. At least we have gained some experience managing some COVID-19 patients. We still applied such experience and see that they survive as well.
With the third wave of the coronavirus spreading across countries, the uncertainty arising from this unprecedented situation also calls for more caution, as authorities say they are more determined than ever before to tackle any outbreak of the new variant of the COVID-19.
And the African Development Bank has provided over $288 million to support the efforts of the federal government in responding to the pandemic. President of the bank, Dr. Akinwumi Adesina, said this while delivering a lecture at the American University of Nigeria commencement ceremony in Yola, the Adamawa state capital. According to him, government is implementing bold social programs to reduce the number of the poor through interventionist programs. But he says the fact of the matter is poverty is not just about money. He says there is poverty of health, and health is wealth. Now, the Lagos state government has warned of a possible third wave of the coronavirus pandemic in the state. In a statement, the governor, Babajide Sanwo-Olu, reeled out statistics of the increasing number of cases and the need to buckle up, especially as the Islamic religious festival of Eid al-Adha nears. According to the governor, the number of confirmed cases, which had earlier reduced to 1% average as of the end of June, has suddenly increased to 6.6% rate as of Thursday, July 8. Mr. Sanwo-Olu is urging full compliance with all the protocols imposed in the country as he threatens to prosecute anyone found to have willfully flouted the protocols, particularly the travelers. Now, as at today, Lagos State had recorded a total of 60,366 confirmed cases of COVID-19. Of this number, 58,515 have recovered in community, and over 1,000 are currently being managed actively in community as well. Over the course of managing the pandemic, the Lagos state government stated that about 4,382 patients have been admitted into various COVID-19 care facilities in Lagos, and it has registered over 400 fatalities. So far, the state reports that over 500,000 samples have been tested in the state since the pandemic started. And today, the state can boast of 30 accredited testing centers That is 26 private and 4 public health laboratories in the state. Well, to talk more about the threat of the third wave in Lagos, joining us is a public health physician, Dr. Shalom Oni. Glad you could join us on the program.
I'm excited to be here, Millicent. Thank you very much.
All right. Now, looking at the increase in cases, which we saw from Monday up till Friday, even though yesterday it appears we just had very few cases, but then there seemed to be a steep increase, pretty much what we're seeing around the globe. Are you concerned?
Millicent, I was here 5 weeks ago, and I bluntly predicted that Nigeria is going to slide into a third wave. And for me, it's not a surprise, because pandemic management is scientific. You can predict where you are and predict where you are going based on the data, that you are getting. And the data you are getting is a function of the measures you have put in place. For me, where our MPI went south, that was where we got it wrong. And for now, I think we are still getting it wrong.
And that's the fatigue. But on the other hand, you know that Lagos, I mean, since the beginning has been the epicenter. Looking at all of the tools, seeing as it's just, I think vaccination in Lagos has just been about 1%. Do we have the tools? Do we?
Well, we are in an unfortunate situation. How do I mean? We are not producing the vaccine. Let me put it this way. We are begging for the vaccine, trying to see what we can get, from our neighbors, around the globe. So we are at the mercy, of these countries. If they give you vaccine, fine. If they don't, you're on your own. And the number of vaccinated individuals, we help a lot in combating, a third wave. How do I mean? It has been said, the Delta strain had a rampage in UK, in India, and UK. And it has been said that the impact of Delta strain was felt majorly in individuals who have not been vaccinated. So if we can increase the number of individuals who are going to be vaccinated, then we are sure that we're on the right track, in containing the wave of the Delta strain.
Just to quickly get your thoughts, Lagos State said people shouldn't patronize non-accredited COVID-19 treatment facilities. I mean, we had this problem at the beginning of the pandemic. Is there still fear that there will be stigma, discrimination, and people won't be forthcoming if they feel they have the symptoms of COVID-19?
Well, if you want to judge by what has been ongoing from the start of COVID-19 and now, the level of stigmatization has reduced. In fact, right now, if you tell an individual that, you have COVID-19, they say, no, you're joking, you must be joking, and things like that. But before, at the onset, people try to stay away from you, So the stigmatization has reduced. Well, however, in order to ensure that people are effectively managed, properly managed, it is important you go to accredited centers. And how do I mean? There's the issue of need for oxygen cylinders. It's not all the facilities that can provide that 24/7. Then professionals, on board. Things that has to do with your vital signs monitoring. So then facilities for testing. These are things, that will be done in accredited centers, which may not be available elsewhere. So don't model up, the management for us. Go to accredited centers so that you can be properly managed and can know what we are dealing with. So I think for me, that's what the fear is. Not really that the level of stigma is still high. It has really, really come down.
All right. We'd like to thank you, Dr. Shalom Oni, public health physician, for joining us on the program.
So it's a pleasure to be here. Thank you.
Well, outside Nigeria, President Cyril Ramaphosa, in a national address last night, condemned the violence of what's going on, and that is talking about the Zuma protests there. He also told the nation that given the sustained high COVID-19 infection numbers, the country will remain under level 4 restrictions for another 2 weeks.
That from now until the 25th of July, the following measures will remain in place. All social, political, religious, and other gatherings remain prohibited. A curfew remains in place from 9 p.m. until 4 a.m. The sale of alcohol remains prohibited. Schools will remain closed until the 26th of July.
Joining us is Dr. Walter Kasadi Mulombo, the WHO country representative to Nigeria, as he talks to us more about the trends of the coronavirus across the world. Thank you for joining us on the program.
Thank you for having me in the program. It's a pleasure.
Dr. Kasadi, how is the World Health Organization responding to the needs of the African continent, low-income countries, to procuring more vaccines?
Thank you for your question. Yes, it's a huge concern for WHO to see that the African continent is still lagging behind in terms of accessing COVID-19 vaccine. Right now, it's really around 0.3% of the population in Africa that have access to COVID-19 vaccine, and yet there is more than 3 billion doses already distributed, mostly in high-income countries. So WHO is working with all the participants to the COVAX facility, which is a platform sponsored by WHO, CP, UNICEF, and Gavi to ensure access to vaccine in an equitable fashion. So we are working with all the players, but also stepping up our advocacy, reaching out to high-income countries so that we share the doses of vaccine and help Africa and other low-income countries in the region to access the vaccine. As we said over and over again, no one will be safe until everybody is safe. And we are hopeful that in the coming months, the situation might change. We are also working with manufacturers to try and waive the patent so that we could expand the capacity for local production in other places. And like you know, there was already a step into that direction with the establishment of the vaccine manufacturing hub in South Africa recently. So it's a work in progress, and we are hopeful that with adequate advocacy, we will come up with some concrete strategy. As you know, WHO is calling for all the region, all the country, to ensure that at least 10% of the population are vaccinated by September and 40% by December. This will help accelerate the pace to immunize the population and hopefully come out of this acute phase of the pandemic. Over.
There are certain professors of medicine who have talked about Nigeria having a peculiar case such that they're saying that we might not actually need the much vaccines based on perhaps WHO measures, you know, to getting herd immunity. And this is because of perhaps our numbers. What do you think about that?
Sorry, what the professor said?
So the professor was talking. Yes, the professor was talking about. He's saying that, you know, we have a peculiar outbreak in terms of the number of cases we're recording, also the number of deaths and the number of people that are recovering, so that we might not need to spend so much on procuring vaccines.
Yes, it's true that the Nigerian COVID-19 response is one of the best. We've been able to avert the doom that was predicted, but we have to remember that it came as a result of drastic measures that were put in place by the federal government and collaboration with the state. Strong measures were taken very early when the pandemic first hit Nigeria. So we have a positive experience of implementing public health and social measures, and they worked. It shouldn't be the reason to be complacent. So we really need to immunize as many people as possible to ensure that herd immunity is established. Of course, the debate of buying the vaccine versus not buying them, it can be there because of the low number. But we have to remember that we haven't reached yet the capacity of testing that will be able to detect all cases in Nigeria. And we are not secure yet in front of variants that keep emerging. So it's very important we use all the tools available. It's not social measures alone. It's not face mask alone. It's not the vaccine alone. It's all these measures until the whole world will be safe. This is what I can say about that statement for that professor. Over.
How much of a threat would you say the Delta variant is, which appears to have already surpassed the Alpha variant? I mean, do you expect that, public health, I mean, this will impact public health measures of governments? And this is looking at how, a lot of the African countries are experiencing the third wave and looking at, Nigeria's situation.
Yes, the Delta variant is very dangerous, it's highly transmissible. It has the potential to increase transmission quickly in a population, but it remains sensitive to all public health measures that were put in place. So Nigeria needs to remain on high alert to avoid the third wave. And we are surrounded by countries that have started seeing those increase. So we shouldn't be complacent, if I can say it in one word. The danger, the risk is still there, and we need to continue, including securing enough vaccine for the population. As it was already planned through the Presidential Steering Committee on COVID-19 vaccine. So I still believe that Nigeria needs more vaccine and more people need to be reached and immunized.
Finally, before we let you go, the Director General of NAFDAC said that the WHO is auditing the agency so that Nigeria can begin the production of COVID-19 vaccines. I mean, has there been an outcome of that audit?
WHO is working with the Nigerian government to assess the readiness and the capacity for local manufacturing. We have a maturity level for different countries, and recently we have reassessed the capacity of NAFDAC in terms of securing safety of medical product. On the other hand, we know that Nigeria has got facility. Nigeria used to produce vaccine in the past, and those facilities could be upgraded for Nigeria to produce vaccine locally. So WHO is in touch with the national authority. We are aware that there are plans to scale up the local production capacity, and as part of our mandate, we are willing to continue to support Nigeria to establish that capacity. It will go a long way, giving the population, giving the capacity already on ground and the history. Nigeria should be able to establish local production capacity, which will be good not only for the country but for the region. Over.
All right, we'd like to thank you. Dr. Walter Kasadi Mulombo is the WHO country representative to Nigeria. Thank you for joining us on the program.
You're welcome.
Well, a group of scientists are warning the UK government that patent protections on COVID-19 vaccines are threatening the security of the country's vaccination program and could lead to further lockdowns. This comes as the UK Health Secretary says the country looks forward to the time when all COVID-19 restrictions are lifted. However, tests need to be passed to proceed, the first being the success of the vaccination program. Here's a global update.
The UK's Health Secretary also confirmed the final stage roadmap on July 19, saying the government firmly believes this is the right time to get the nation closer to normal life. He says England will move to the next stage of the roadmap on the 19th of July. Neighboring France is expecting new measures to be announced by President Emmanuel Macron in a televised speech today. It comes amid growing debate in the country on whether inoculation should be mandatory for medical workers, with France health regulator advising for the jabs. Also on the table is a stricter implementation of health passes, which came into effect in early July as French people depart for their summer holidays. South Korea's government has carried out its strictest anti-coronavirus restrictions to date on the level 4 in the Seoul metropolitan area to curb the spread of virus amid the fourth wave of the COVID-19 pandemic. Under the restrictions, restaurants and other public places only allow gatherings of 2 persons after 6 p.m., with large-scale activities being banned. Public gatherings, service venues are all prohibited or restricted for business, and showers indoor sports venues are also prohibited. Finally, the total number of confirmed COVID-19 cases in the United States surpassed 33.85 million as of Sunday. The country's death toll has also surpassed 607,000. The United States still leads the world in the numbers of both confirmed COVID-19 cases and deaths. The country has only administered at least 332 million shots to 55% of the population.
Well, let's all stay safe and continue to take responsibility. A reminder of our earlier breaking news developing the Emir of Kano, Al-Hassan Adamo. He has been freed after spending a night in bandits' captivity in Kaduna State. We understand the other 13 members of his family are still with the kidnappers, who earlier demanded 200 million naira as ransom. It's not confirmed if any ransom was paid before the release of the 85-year-old traditional ruler. Well, you can find that story and more updates on our website. It's channelstv.com. You can also find an understanding of the pandemic, plus other stories, breaking news, politics, sports, business. Well, that's the program this evening. Thank you for watching. I'm Millicent Nwaka. Stay safe.